Les lésions de pression. Donc, les lignes directrices sur les lésions de pression arrivent juste à point pour nous aider à cette fin-là. Je pense que le futur des BPG, c'est vraiment dans le fait que dans chaque intervention, dans chaque pratique qu'on fait, de toujours savoir pourquoi on le fait dans le fond, de vraiment avoir des bases solides et non plus faire des pratiques de soins par habitude et parce que ça s'est toujours fait comme ça.
You can see that these nurses are really committed to their work and this program. Doris, tell me about the Champions Network.
At the present, we have over 500 best practice champions who have committed to a 2-year time frame to help promote, influence, and implement PPGs within their institutions. They're so important to the overall success of the project, and that's why we call them champions.
And we're pleased to have one of your champions here today, Joy Rameus from the Doctors Rakai Center, which is a long-term care facility. Joy, welcome to the show.
Thanks, Sandy, for inviting me.
Now, Joy, tell us a little bit about the Champions Network.
We're all best practice champions. We attend a 2-day workshop, and then we keep in touch through the RNEO. There is an actual section for best practice champions. We also have monthly meetings where we learn and become involved and get together. There is a section on the RNEO where if we have any questions or concerns, we can talk and ask people for backup. And basically it is integrated through everything we do. And we help and we educate staff. My position is the nursing home as a staff educator, so we go through and we learn and we look and we just work on it continue for sustainability. When I work at the college, it is brought into through the curriculum, so whatever I am teaching, I then bring it in, so it becomes a part of a nurse's life.
Champions such as Joy are wonderful, and they are promoting and influencing the uptake of these guidelines. And we need many, many more nurses like Joy, and it would be wonderful if others would also become best practice champions.
Tazim, I think it's time for another profile. Who have you brought with you this time?
This particular film clip is in the home healthcare setting, where you will see best practice guidelines in action.
We really see ourselves as a knowledge-based agency where we can combine knowledge with practice. So best practice guidelines would allow us to take that knowledge off the paper, off the page, and actually apply it to our patient care. A lot of what our role is in community is to teach. And in order for us to be able to teach and for the patients to have confidence in us and what we're teaching them, you have to have a therapeutic relationship in place. But I'm in a bit of a unique position, different from some of my colleagues, in that I actually consult on patients that are being followed by other agencies, other service providers in the area. So with the best practice guidelines and the knowledge that we've learned from those, I've been able to take it outside of my own agency and share the knowledge with other nurses in other agencies, and they're learning as well. We implemented the best practice guidelines for St. Elizabeth within our wound clinic settings. There was a really positive response. There was a lot of excitement. The nurses were thrilled with the idea. Of course, the patients could sense that enthusiasm as well. So, sharing of the knowledge is a wonderful thing, and it just promotes better patient outcomes all across the board.
And we have no shortage of important guests on the show today. Please welcome Ethel Mead, co-chair of the Ontario Senior Citizens Organizations and vice chair of CareWatch Toronto. Ethel, welcome to Making It Happen. In terms of quality care, what does this program mean to older people?
It means a lot to older people, because the older that you get, the more you know how much you are going to depend on nurses sooner or later. And these guidelines that I've seen seem to me to be raising the level of care that will be provided, and even educating the people who will be cared for so that they will know when they need nursing care and when they don't.
Ethel's comments fit beautifully also with the Elder Health, Elder Care initiative that RNO and a group of other stakeholders are leading, and Ethel Mead and her group are also part of that.
I certainly want to congratulate the RNAO for making this possible for Ontario nurses.
And along with the best practice guidelines in the area of elder care, we also have guidelines in the area of primary health care, home health care, mental health care, and emergency care.
In wrapping up, are there any other points that should be mentioned about this exciting program?
Well, Sandy, what is critically important to understand here is that nursing is a knowledge profession. And if indeed it's a knowledge profession, which means also will impact clinical and health outcomes of people and system outcomes, then evidence-based practice is a must for the practice of every single nurse in this province and everywhere else, which means these best practice guidelines are a critical tool for nurses to utilize to ensure that their practice is based day in and day out on the best available knowledge that we have.
And also, Sandy, we can't forget the hundreds of nurses, organizations, and the public at large who have been engaged and who are involved in the various aspects of development, implementation, and also researchers who've been involved in evaluation. And of course, we can't forget the leadership that the Registered Nurses of Ontario, the RNAO, has taken in this project.
Well, it looks like our time is up for this week's Making It Happen, and what a tremendous story. My thanks to all our guests and the Registered Nurses Association of Ontario for bringing it to us, and thanks to you for joining us.